Good evening, everybody. Welcome to another knowledgeable session on NABH indication series on entry level. So today we have come to hear about the chapter 9, which deals with the human resource management, and we have a very knowledgeable and very experienced speaker amongst us, Dr. Latha Venkatesh. So she is a professor and also the principal at the College of Nursing at AIMS, Delhi. She has 32 years of experience in teaching and clinical nursing and administration. She has done a doctorate in nursing, and she's also a guide at the WHO consortium. She has written a lot of articles in journals, and she's also the advisory board member at the Indo-Sweden Collaboration Initiative. She is also a committee member at the ICMR Bhopal. So we have a very knowledgeable speaker, as I said, and she will deal with the nuances of how to go about NABH in the HRM chapter. Ma'am, please, you can start.
Thank you, Adel, for that kind introduction, and a very good afternoon to all the participants. And we are here, and also I must congratulate CAHO for taking the initiative to educate the healthcare workers on accreditation standards, especially the pre-accreditation standards. So it is a series of learning events in which I am asked to talk about the accreditation entry level standards for HCO and SHCO is to be discussed today. And if you look at HRM, it is a very, very important chapter because it concerns with the human resources, and lot of verification by the assessors will be done during the accreditation process. So let us see the summary of the standards. If you look at, there are mainly 5 group of standards. The HRM 1 deals with staffing. This includes the manpower planning, credentialing, privileging, selection criteria, recruitment criteria. All those will come in staffing, and the mix of staffs. So there are so many standards part of HCO and SHCO NABH standards. And HRM 2 deals with staff training, because once we recruit the members, the training is an ongoing one. Not only the induction training which is conducted at the time of joining, there should be ongoing training which will empower the manpower, which will empower the staffs to continue to perform to their best levels. And the HRM 3 deals with disciplinary and grievance handling procedures, and HRM 4 deals with employee health, and HRM 5 deals with personal records. What are all the documents which are to be maintained as part of the personal file of any given employee in the organization. So let us see these standards in detail, and I think by now you must be familiar how the structure of these standards are placed. We have standards which has to be supported with objective elements, and key performance indicators are there for every chapter. HRM standards are grouped into 5 major standards. So HRM 1 deals with staffing, HRM 2 deals with staff training, and HRM 3 deals with grievance handling and disciplinary procedures, and the 4th one deals with the health of employees, and the 5th one deals with what are all the documents which needs to be maintained by a HCO as part of HRM. This HRM chapter is the people dimension in manage. You have to understand the people dimension of HRM management, and acquiring, providing, retaining, and maintaining competent people in right numbers to meet the needs of patients. In other words, it is known as the selection criteria, recruitment process, and having appropriate skill mix. Welfare of the staff and their training and health needs. And human resource is the most important resource of a hospital. We need to understand. So it is important to recruit and select appropriate people, and empower them with adequate knowledge and skills, and take care of their personal health. And human resources are an asset for effective and efficient functioning of a hospital. And human resource management has got multiple components. It has several overarching functions. Like you need to have resource allocation according to the needs of a department, according to the number of patients, according to the criticality of the patients, you need to allocate the human resources. And you need to have their personal data management right from when they start applying for the job itself. The personal data management starts, and we will be looking at in detail in the rest of the slides. And resource management, skill management, performance management, attendance and their leave management, training of them, and ensuring that they receive all the benefits which are part of their which has been listed eligible for the employees of the hospital. So like this, you know, the human resource management has got multiple functions and multiple components of management. And we need to understand, first of all, the definitions which are frequently used in HRM. That is, first of all, we need to understand employee. Who is an employee and who is a staff? You know, this understanding is very, very important because hospitals have got multiple types of employees working. Some may be full-time, some may be part-time, some may be visiting, some may be outsourced, some may be contractual. You will have multiple category of employing them. But irrespective of whatever is the type of employment which is being adopted by the hospital, all of them comes under employee, and all of them are entitled for certain benefits. So employee refers to all salaried personnel working in the organization, and the staff refers to all personnel working in the organization, including employees, fee for service medical professionals, part-time workers, contractual personnel, and volunteers. Even volunteers, you have to understand this terminology. And if you look at HRM 1, the organization has staffing which commensurates with patient care needs. So HRM 1A, the standard says mix of staff commensurate with volume and scope of the services, and staff recruitment process is well defined. So this is very, very important. Many people do not understand what is this mix of staff and what is the volume and scope of the services. If you look at the MCI norms or the Nursing Council of India norms, they have given the norms how many to be appointed for the given patient strength. For example, if you take the nursing staffing pattern, you are supposed to have a nursing superintendent. And if you are above 500 bedded hospital, you are supposed to have a nursing director or chief nursing officer, and you are supposed to have nursing supervisors. And you are also 1:3 ratio is recommended for a teaching hospital between the patients and nurses. That means every 3 patients should have one nurse. Whereas if it is a non-teaching hospital, then you can have for every 5 patients, 1 nurse. This is applicable to all the 3 shifts, not on a single shift. So like this, we need to refer to the norms which is given by the statutory bodies for staffing. And when you have this number of staff in hand, you also have to categorize them, like based on their experience, based on their educational qualification, or based upon the kind of skill they have. You have to have some kind of guiding principles. For example, in nursing, if you take, you have BSc nurses, you have GNM nurses, you have MSc nurses, you have ANM nurses. So in a ward, when you are posting, you have to have a mix of these staffs. And some would have worked in critical care units, some might have worked in non-critical care units. So based on the experience, you have to give them the location of working. So like this, you know, mix of staff will depend upon the volume, the norms, and scope of services. And staff recruitment process must be well defined. And how to implement this HRM 1? You have existing manpower. You have to have the availability of list of hospital staff, their registration number. Doctors and nurses, they have the registration number, which can be verified through the council website. If you log in and put these numbers, you will be able to see whether they are licensed and is it a valid registration number. And maintenance of nursing deployment list, where all you have posted the nurses on 3 shifts, morning, evening, and night shift. and availability of adequate number of staff as per the guidelines. Guidelines are MCA guidelines, Nursing Council of India guidelines. There is also one SIU guidelines, Staff Inspection Unit guidelines. So anyone you have to follow. And staff recruitment, this commensurates with scope of services and the workload. And doctors and nurses, as per the guidelines and statutory guidelines, they have to be placed. And we need to provide this, already I have explained, and provide induction training within 15 days from the date of joining. Usually this induction training also, hospital have two different types of induction training. One induction training is a general induction training in which they will be educating the employees on about the history of the organization, and what are all the routine procedures which are to be followed, what is the code of ethics or code of conduct, and what is the uniform policy, leave policy, medical reimbursement policy. So which are all common to any employee who is joining the institution. Whereas there is an area specific training, that is according to the area where they are posted, they will be trained. And this general induction training also can include general procedures like hand hygiene has to be practiced by everyone. Biomedical waste management has to be practiced by everyone. So these are some of the common topics which will be covered under the general induction training. Needle stick injury, irrespective of the category of employee, all have to follow same protocol. So this will be part of the general induction, whereas you will be bifurcating them and posting them in multiple areas of the hospital. That time area specific training has to be given. For example, if you are placing a nurse in a OT, you have to give her induction training about the OT techniques, OT procedures, and for ICU nurses about the intensive care, and in emergency, like that, according to the area where they are posted, area specific induction training has to be given. So this bifurcation will be helpful to be more focused on what is required for them to perform on the board. In HRM 2, there is an ongoing program for professional training and development of the staff. So here, all staffs are trained on relevant risks within the hospital. Staff members can demonstrate and take actions to report, eliminate, and minimize risks. Training also occurs when job responsibilities change or whenever new equipment is introduced. These are all the three major standards under HRM 2. You know, risk happens in the healthcare setting. It can be a physical risk, it can be a biological risk, it can be a social risk. The risks are classified in different categories, and every organization should have a hazard identification and risk assessment pro forma, as well as the schedule. So on a periodical basis, this HIRA has to be done. In short, it is known as HIRA, HIRA. So the staffs must be educated not only to do the risk assessment, they also should know how to resolve the risks once it is identified. So how to escalate if some risks are being noted, and how to resolve the potential hazards which can happen in any given unit. I will tell you a simple example for this. In a hospital, the incubator went on fire, and the nurse was having presence of mind. Immediately she lifted the preterm newborn and ran away out of the unit. So the life of the preterm was saved. So the hospital's name also was saved. So this is the kind of training which you have to give. The moment you, first of all, they must be doing a periodical assessment to prevent such risk. We do not want incubators to go on fire, and we have to prevent that. And if at all, if it happens, how quickly to act and save the lives of the human being. So all these have, the training has to take place. And also, whenever new equipments are purchased, the staffs associated to handle it have to be trained. And whenever job responsibilities change, also they have to be trained. This part is very, very important, because especially when it comes to nurses, there is a policy called floating policy. That is, one unit may have less patients, another unit may have more patients, so their nurses are shuffled between the units. But they have to have a policy which is guiding between which units they will shuffle. For example, the ward is light. You cannot put the nurse suddenly in ICU or OT, because she will be totally helpless to handle the gadgets and the kind of care which is expected in an ICU setting or an OT environment. So you have to have the exchange units, between which units you can exchange them, and you have to appropriately train them. For example, exchange can take place between labor room and NICU, but you have to train them in both the procedures. What happens inside the labor room, what happens inside the NICU, because both are usually nearby units on the same floor, and exchanges happen. Or between the intensive care units, you can exchange. A hospital can have multiple intensive care units like medical ICU, surgical ICU, neuro ICU, transplant ICU, like that. So you can exchange between the intensive care units. So you have to decide where are you going to exchange them, in view of having less patients or more patients to help each other. Then you have to train them appropriately. Sometime you may have a policy that every 3 years their area work will be changed. So whenever an area of work changes, again the induction training or reorientation has to be scheduled and conducted. And how to implement this HRM2? You have to have appropriate training calendar, training topics identified, training schedules, training evaluation by doing pre-test, post-test, and documenting the improvement scores. All these are part of the training. So on PAN hospital risks focused training in specific areas have to be done. Incident reporting has to be done. You should have a structured, standardized form for incident reporting, and on revised new job responsibilities and use of a new equipment, and prepare training schedules for induction and at regular intervals. Because the training is not only at induction level, you have to have ongoing training, because healthcare is ever changing, the protocols are changing, the treatment guidelines are changing, newer equipments come, and multiple other changes which happens, and you have to train them appropriately. So periodical training is required, and some of the trainings are valid only for 2 years. For example, the basic CPR and advanced CPR, the validity is only for 2 years. So every 2 years you have to train them. So like that, the training is an ongoing activity. So better to prepare an annual calendar of training and train all categories of employees. And awareness, you have to create awareness about the protocols for identifying, preventing, and managing potential risks within the hospital environment, and demonstrate best practices for handling potential risks. Staff awareness of contact numbers and reporting mechanisms, and promotion of error reporting culture is very important. They should not be afraid to report some errors has happened, because saving human lives is the priority. So if at all they report something, even if there is lapse in their part, please do not have a punishing attitude. You have to reward error reporting so that they feel free to bring out the potential risks in an environment, so major incidents can be avoided. And HRM3 says organization has a well-documented disciplinary and grievance handling procedure. There are also Supreme Court guidelines, and many every organization is expected to have an internal complaints committee. Earlier it was called a sexual harassment committee, but now we call it as internal complaints committee, with designated members from within the organization and outside the organization. You should have at least one external member, so employees feel free to express their concerns, especially related to sexual harassment, to an external member. And the contact number and email ID of the external number should be shared with all the employees. And so the standards of HRM3 goes like this, that is a documented procedure with regard to these are in place, and related to disciplinary and grievance handling. And the documented procedure is known to all categories of employees in the organization. So you have to give them in writing, and better take a signature from them that they have received a copy, and display wherever it is possible what is the mechanism for handling their grievances, and actions are taken to redress the grievance. You need to have a committee. Committee has to meet periodically and as and when the grievances arise, and the committee has to settle down the issues, and if it is not possible by them, then appropriate counseling can be given to the employees, and some kind of wellness programs or stress reduction programs can be conducted. A lot of activities can be organized part of this disciplinary and grievance handling procedure, and it need not be always related to negative incidents. It can also be positive incidents, so some the attendance can be rewarded, best disciplined employee, punctuality, something like that. It need not be always negative. You can also have some positive aspects of promoting the discipline in the organization, so your number of grievances are less. And the definitions you need to know: disciplinary action is the recommended sequence of activities carried out when staff do not comply with laid down norms, service standards, rules, and regulations of the organization. And grievance redressal is the recommended sequence of activities carried out to address the grievances of the staff. And how to implement HRM 3? You need to have certain disciplinary actions, and you have to list what is classified as unacceptable action and the reporting mechanisms. You have to nominate disciplinary committee, present case to disciplinary committee, describe the disciplinary procedure, recommend and implement the actions. And part of grievance redressal procedure, you have to set up internal complaints committee as per the POSH Act. And you know what is POSH, full form is Prevention of Sexual Harassment. And also General Grievances Committee, provide name of the internal complaints committee members to women employees, maintain confidentiality, communicate proposed actions, and take actions to resolve the issue as per guidelines. And you need to have documentary evidence for all these supporting the actions taken. And it is also necessary to include this grievance handling as a topic as part of your induction program or orientation program, so they are aware in case if there is any uncomfortable events which takes place, how to report and how to get rid of the unwanted experiences. And documentation is also very important, that is procedure handling disciplinary and grievance issues, and minutes of the grievance committee meeting. And HRM 4 says the organization addresses the health needs of the employees, and the standards are health problems of the employees are taken care of in accordance with the organization's policy. Organization can have its own policy. It may be insurance, or it may be partly supported, or it may be fully supported. And then occupational health hazards are adequately addressed. Occupational health hazards are, they may be exposed to the infectious diseases, so better to immunize them with hepatitis B, and now of course with COVID vaccination, and TT. TT is also given to all staffs now, and for the kitchen employees, typhoid is a must. And if you look at the occupational hazards, the hazards may be physical hazards, chemical hazards, biological hazards. Physical hazards are back pain, shoulder pain for canteen staff, ear pain for the staff in high decibel area like CSSD, laundry, and radiation hazards. So we have to provide appropriate duty hours to prevent the back pain, adequate rest hours, and adequate best type of furniture like cot and other things which will not make them to strain too much. And then you have to give the ear muffs for the people those are working in generator room, those are working in CSSD, laundry, where there is always continuous noise. And radiation hazards for the people working in the imaging areas, X-ray, cath lab, CT scan, and C-arm where it is used in the theater, and C-arm used in the for ERCP, endoscopy rooms, and then also the dental chairs, bone densitometers. So all the employees need to be given the TLD badges. It is not only the operating surgeon and the technician. You have to give to the anesthetist and the staff nurses also in the theater, those who are handling C-arm. So similarly, cardiac cath lab, everywhere this TLD badges have to be given. And chemical hazards, we need to identify the hazardous chemicals which are used in every department, and there is a sheet called MSDS, that is Material Safety Data Sheet. If you look at the literature of the chemicals, they will have given what are all the harm it can cause, and what is the neutralizer, and in case if there is an accidental exposure to the hazardous material, what precautions have to be taken. So you have to prepare it in a tabular form and keep it in every department for the reference of the employees. Preferably many hospitals display it on the notice boards, So it is accessible for the staff to read, because this exposure to hazardous chemicals does not happen on a daily basis. It happens once in a blue moon or unexpected timing. So immediate action is required. So for quick reference, it is better to display the MSDS sheet in every department. And it is especially in the laboratories, CSSD, and laundry, where more chemicals are being handled. This should be displayed. And biological hazards are exposure to the diseases, which I already said, and you have to provide them adequate PPE and immunization and all the precautions to be taken. Then employee safety, yeah, all staff have to be given appropriate PPE, and gloves and masks should be provided in enough numbers, earplugs in high decibel area, radiation hazard means TLD batches, and TLD batches have to be sent for periodical reading also, and staff handling hazardous material MSDS sheet should be there, material safety data sheet, biosafety cabinets for those who are preparing the chemotherapy, and proper controls where ETO sterilization is done. The cartridge must be stored in a safer manner in ETO, and the exhaust pipe must be going 6 feet above the roof level in the hospital. So these are some of the precautions we have to take. And how to implement HRM4? We need to address their health needs, undertake the responsibility of the employee health, that is pre-employment checkup has to be done before joining, annual health checkup has to be done, and give free treatment or a concessional treatment as per the organizational policy, enroll staff on group insurance scheme. Then prevent occupational hazards by making list of department-wise occupational hazards, allocate adequate budget to ensure availability of PPE, provide pre-exposure prophylaxis like vaccines and post-exposure prophylaxis with the antiviral medications, and conduct induction program. And there is a documented personal record of each staff member. This is very, very important, because the assessors will go through every page of the personal file of majority of the employees. They will do a sampling exercise. Sampling may happen alphabetically. They may tell that, oh, you give me the files with the name starting with the B, or they may ask for you, can you give me the files of the staff, the employees who have joined recently within 6 months, or they may ask a particular category of people, technicians, to check are they giving medications, because technicians are not supposed to give contrast in the CT scan and X-ray area. So they may ask specifically, they may pick up certain files and they may see, and they may think that whether they are regular employees or not. So all this, this files, any files can be asked for verification. So the personal files should contain personal information regarding the employee's qualification, disciplinary action, and health status. And how to implement HRM5? Personal file should have an employee number. Every employee should have a number, like UHID for patients. Every employee should generate number, because nowadays when we go for assessments, we are seeing two different kinds of ID cards employees are wearing. One is a permanent ID card, one is a temporary one, makeshift arrangement. I don't know, they are bringing employees for only for accreditation purpose, which is very, very visible from their body language, the way they answer, from the kind of uniform they wear, and the employee ID. We can easily identify who are all who not their permanent employees. So you need to have employee number, resume of them, and copies of their qualifications, records of their health checkup, vaccination details, and any antecedent verification can be done, list of complaints against the staff from the previously worked area, and disciplinary action taken, and description of the proceedings, if any, which happens during the tenure with your hospital. So this is very, very important to maintain. And there is a procedure called credentialing. Credentialing is verifying whether their qualification is original or fake. So that is a credentialing process, which is not part of the SHCO or entry level certification. And privileging has to be done. Privileging is what are all the skills they are entitled to practice. And in privileging also two levels, initial privileging and full privileging. Initial privileging is first 3 months you give minor procedures, and after they perform under supervision, you give advanced procedures. So that will be full privileging. And annual privileging review has to be done. There should be a committee for credentialing and privileging. So these all have to be done. Now, what is to be included in the Apex manual? In the Apex manual, you have to have confidentiality and access control policy of the HR documents, and fill the checklist of the contents of employee personal file. So any questions which we have come across when we go as an assessor, very interesting events take place related to HRM. You know, job description and job specification also has to be kept part of the HRM file, but that's not for entry level or SHCO. It is for the HCO accreditation. So these are some of the aspects related to HRM management. And thank you, Adel and Kaho and the team of experts here for giving me the opportunity to speak on HRM management. Thank you.
Thank you, ma'am. Thank you once again for joining us today in spite of your busy schedule. Thanks for taking out some time for us. I appreciate your gesture. So thank you, ma'am. And my fellow friends from Kaho to answer some of the questions live as well. So Dr. Santana, Dr. Umashankar, anyone? Yeah. So I think you're already, thanks Santana, you have already answered a couple of questions.
Yeah, so there was this question regarding the A&M nurse. So I just want to brief you all that the A&M nurse cannot directly handle a patient in treating or dispensing of the medicines. She can be as an assistant. So you can call, like we have the BHMS and BAMS who are called as the clinical assistants, we can have the nursing assistants. So all the A&Ms, they can be shown in your HR profile, but they have to be shown as nursing assistants and not directly handling single-handedly the patients. Thank you.
And I think there's one more question which has come up, but whether all trainings are needed for pre-test and post-test.
Yes. You should have a post-training assessment which is done, so you understand and you can evaluate the efficacy of the training. If you do a pre and a post-training session, you will understand or you can have a percentage increase in knowledge and you can present it across to your management. So ideally, compulsory is a post-training assessment. And if you really want to have a good quality training records, then a pre and a post training assessment with an evaluation in terms of percentage of increase of knowledge can help you. Thank you.
Is there any format for the vaccination record? How to maintain a format?
You want us to answer? Actually, the formats are available, which is there on the websites also. But ideally, you need to have the employee name, UHID, date of joining, and if it's a hepatitis, the 0 dose, 1 and 2nd dose with the signature of the employee. Similar with even your COVID vaccination, your hepatitis, and your tetanus vaccination. We can even share it on the group. I think so. We would be having a good format with us. Adel, we can just share it with these people on the group.
We will share some of the formats to them. And do you think is it required? Annual health checkup is at entry level? Is it required?
Yes, annual health checkup is compulsory for all the employees on a regular basis. Vaccination, however, is only for the employees who are in direct connect with the patient. It is not compulsory for the office or the management working staff.
Okay. And there's one question: can nursing superintendent or deputy nursing superintendent can be the chief nursing officer? I suppose that depends on the organization, right? Who can be the chief nursing officer?
Yes, a nursing superintendent can be a chief nursing officer. There's no issues with that. Is annual nursing privilege compulsory? Yes, if you really want quality services in your organization, your nursing privileging has to be done, credentialing should be done, and it really helps an organization with improved quality performance.
Yeah, there are organizations even which do credentialing for doctors even.
Yes.
So it is better to have credentialing for all levels of stuff.
Yes. I think so. There is one question regarding the nurse-patient ratio in NABH accreditation. We are today discussing on NABH certification. So I just want a confirmation from Dr. Marlene Shima that whether she wants it for accreditation or for certification. But by the thumb rule, it is that for in ICU, for ventilated patient, it is 1:1. For non-ventilated, it is 1:2. And for an SHCU, 1:3 is also accepted. And for wards, it's 1:6. It's according to the Nursing Council guidelines.
Okay, I think some of the questions have popped up now. What all investigations should be part of the annual health checkup? I think
Yes,
another
CBC, blood pressure, height, weight, and X-ray test. You need not have the printed copy of it, but you can always have it scanned and kept in your computer. Only in case if there is any adverse event which is seen, or there is some kind of a deficiency which is observed, then you need to remove a print of it and keep it in the file, the employee's file. So these are the essential parts. We'll also share in the group if need be on what are the requirements for the annual health checkup. So,
and there's one question on disciplinary action reports should be maintained separately in the individual personal records. Yeah, if it pertains to one particular individual employee, then it suppose a copy of it has to be part of the individual personal records.
If an employee is applied for a renewal of registration, is it okay? Do you have the previous registration? And if you have the application of the current registration, it is accepted. However, when the new registration comes, you have to present it across to NABH.
Okay. So, what is it? Is it feasible to do acuity-based staffing for 1,000-bedded hospital? Any idea that, Sanna?
Well, it actually depends on the various sections, or you can say the various departments, and based on that only you should be able to manage and present your staff, nursing staff, or whatever staff that you have. However, I think so Uma Shankar has also answered to this.
Yeah. And there's some of the questions in the chat box also. Some is on the job description required for outsourced department. Yeah, it is required. Anything which happens within the hospital premises has to be documented. And there's one, how do we get the material to train the staff? Staff training can be either done internally based on your own requirements, or it could be, you could get the help of external trainers to go with the to align with your needs.
However, yeah, you should have all the modules which are prepared by your HR and your quality team, and then depending upon selecting all the employees in batches, and you should have the training sessions. You should have a training calendar also, which is made annually. Yeah. There is one question from Regita. It is TT compulsory for all staff, especially for housekeeping staff? Yes.
Okay, I think
disciplinary actions need to be maintained in their personal record files. Yes, you have to have the disciplinary actions in each of the personal files as well.
Yeah. So I think we have answered most of all the questions which has come up. So thanks, Sanfana, for helping us get these questions answered, and thanks, thank you participants for joining us today on the for the 9th chapter.